I'm Mabel Jung, and you're watching continuing coverage here at the World Healthcare Congress, coming to you from Washington, D.C. And in our studio right now is Kurt Wrobel, CFO, Chief Actuary at Geisinger Health Plan. Hi there, Kurt. How are you?
Good. Doing well. Doing well.
Well, we are talking a lot about different ways to approach health plans, and coming up with a simpler one seems to be a focus at Geisinger. What does that look like?
I think people need to realize that complexity comes at a real cost, and that to the extent you make plans more complex, you make arrangements with providers more complex, there's a real cost to the individual. When you think about all the complexities that we have in our lives, people think about going on the internet, you have this deluge of information, and I think it's our view that we want to make things simpler to the full extent that we can. There was actually some research done recently by the American Medical Association showing that only 14% of people could answer the most basic questions around their benefits. And so I think there's a real need to start thinking about more simple benefits, more simple approaches as we think about healthcare more broadly.
Okay, and in your mind, simpler means what? What sort of information doesn't need to be on these things that we get every month?
Yeah, I think that's certainly something we're looking at. Explanation of benefits being one of the key things that we're looking at to make more simple. And when you think about people at the most vulnerable times in their lives, getting very, very complex pieces of information explaining the entire benefits. Just to give you background, my wife is actually Canadian and is not used to this complexity, so I hear it at home when we get the explanation of benefits. So it's one of those things that's really, I think of it all the time in terms of opportunities to improve. But that's just one piece of the opportunity. The other is on the provider side as well. We just had a discussion about value-based reimbursement. And one of, I think, the concerns that we have as an organization is the extent you make everything more and more complex, you bring more and more financial arrangements to individual providers, it just makes things more complex. They're not able to react to it. So one thing we are doing at Geisinger is we've changed the compensation approach to make it a simple salary-based model where we ask people to follow a basic social compact. And it's about providing high-quality care, access, providing research and teaching, being a good citizen, some very basic tenets to ask people to act like providers and not think completely about all the financial implications of what they do.
Okay. Now, you have a very unique perspective from your actuarial background. So what is an ideal reimbursement approach that may be scaled, no matter what kind of organization you work at?
I think there's two approaches. One is sort of what we do at Geisinger, where we're connected with a health system, and that's, I think, the easiest way. So we can think of everything collectively as a single Geisinger organization. So in collectively thinking about taking risk, we take risk as we sign up people on our Medicare Advantage products or commercial products. Everything we do externally in the marketplace, we then have the whole premium dollar, and we can sit down with our own hospital system and have discussions about reducing costs, but also providing high quality care. I think that's the simplest way. Now you asked the question at scale, and we're fortunate enough to have been in the health plan space for a number of years, since 1985. We're fortunate. Now the scaling aspect of it, I think there's twofold. One is actually providers opening their own insurance company is one avenue, but the other is really thinking about different payment approaches. Purely from an actuarial perspective, the most efficient is bundled payments. And that gets into the risk transfer. One thing that I'm personally really concerned about is giving providers too much risk. And that gets into that insurance component of the risk. So there's a lot of ACOs and total cost of care arrangements where we're asking providers to take risk for an entire population. Well, there's certainly positives to that, but in taking that entire risk, there could be a lot of unintended or unexpected events that occur in a population to make it more costly. So even if the provider does everything well, they could still have an adverse result because they're taking on so much insurance risk. Okay. Now, bundled payments is different. You're asking providers to take on a discrete amount of risk on an individual within a defined budget. So it gives them something where they can take on the risk more efficiently, but also track their performance relative to that budget in a more discrete way.
Well, one of the things that we haven't talked a lot about at this meeting is the triple aim, because people seem to be a little bit distracted, but what you're talking about is actually still putting that at the forefront of your priorities.
And that should be the forefront of everything that we do. What we do at the Geisinger Health Plan is our goals are embedded within that triple aim. We want 5-star quality. We want to reduce our cost of care to 2% per year. And we also track something called a Net Promoter Score, which is how our consumers view us, and how many would promote us. And that's among our 3 goals that we track to. And when we talk about the context of simple, there's a lot of components where it's important. When you think about a consumer, I think people are not looking for a more complex system. And the best way to improve outcomes for individuals in terms of customer service and others is a more simple approach. The EOB is one clear example of that.
Okay.
And then when you think about it at the provider level, we want providers to provide cost-effective quality care. That's the bottom line. We think the best way to get there in many cases is through more simple reimbursement approaches, particularly within our own clinical enterprise, our own hospital system. Outside of that, we talked a little bit about bundle payments as being another option in terms of reducing the cost of care.
What's another key takeaway that you want attendees to have from this meeting?
You know, I think the most key takeaway, and this is something that's very important for not just me personally, but the entire actuarial profession, is keeping an eye on what the ultimate goal is, which is that we want to create a financially sustainable long-term model, but the most important thing is providing cost-effective quality care. We've been, over the last several years through the ACA and others, there's been all this focus on the financial piece of things. And I think it's my view that we need to shift that focus to providing high-quality care as being the most important. And so the key takeaway I'd have is that on the financial front, we're trying to make something seamless, something that's behind the scenes so doctors can do their job, providing cost-effective quality.
You have a choice of different meetings to attend every year, I'm sure, Kurt. Why choose to come to the World Healthcare Congress this year?
I think one thing that I particularly appreciate is it's so comprehensive. I mean, there's so many, looking at the different schedule, the different meetings that you could attend, I mean, there's just a whole host of different events that you can attend. So it's been a great experience.
Great. Thank you so much for your time today.
Okay, thank you.
And thank you for watching. Stay tuned. We still have comments to come from the AARP.